Good day to our viewers. You are watching the Health Chronicle Spotlight, and I am Doc N. We recently attended the annual conference of the Public Health Association of South Africa, which was held at Durban's beautiful Golden Mile at the Elangeni Hotel. Now, the conference was attended by many key people such as academics, specialists, civil society, and advocacy groups. The theme for the conference was on sustainable health, and we spoke to the executive management on the reasons for their choice of this theme and what it meant for you as the community.
The key reason was this year was the target date for the Millennium Development Goals, and there's been a changeover to the Sustainable Development Goals. So I think the focus globally has been on sustainable development and health. Based on that, we decided that it would be very appropriate to choose that as our conference theme for this year, realizing that health doesn't operate alone. Health has an impact in terms on sustainable development and vice versa. I think going forward, multiple sectors have to play a role in achieving our health goals, hence the choice of theme.
The public, the general public, the patients that I see at the hospital, the public that are being affected by unhealthy environments, unhealthy water, untreated water, that are sick because of public health issues that could have actually been addressed by health professionals and also politicians.
As a developing country, we are faced with numerous healthcare challenges, namely job security and leadership. The youth of today are hungry for success, but post-graduation, is there security of jobs? We chatted to key individuals to find out the job security for future public health practitioners.
Job security is a myth, really. Come on. I think you're asking the world to be stable while you get your life together. I think in this day and age, we really need to be moving towards trying to make a difference. So job satisfaction in public health, yes, absolutely. But job security, I think companies don't commit anymore, but burdens of health problems still exist. There are problems that are really needing creative, energetic young people to throw themselves in, even though they're not going to become rich and famous.
The challenges regarding leadership and management, particularly in the context of the South African public health system, is the next frontier that we as clinicians need to face. We have extensive expertise in terms of clinical medicine. We also have, at a broader national level, fairly robust and detailed policy from policymakers. The problem has historically, particularly in recent times, been in implementation. And a large area of that challenge lies with middle management. Institutional managements, managements within clinical departments, clinicians who are taking on the roles and responsibilities of management, but not necessarily with the expertise or the training behind it. And this is a very important gap that we need to fill to bridge the gap between policy and implementation.
Apart from scientific research, the conference provided a powerful platform for innovative projects, such as the concept of health clubs and skill sets needed to diversify this profession. We chatted to key specialists on their thoughts and ideologies of making a change using innovative approaches.
We came up with the idea of a community health club, which is really more than just a gathering of people who actually become a member. It's rather like going to church or a religious group. You actually adopt the values of that group. So you work with the group to develop what we call a culture of health or culture of hygiene. Everything you do is done in a hygienic way. So that group meets every week, just like you do when you go to church, and you build up your friends from that group. They're your reference group. And when that group gets together for an extended period of time, 6 months or a year, you find that really they become a united force. And when we look at the word community, we sort of assume very often that it's a functional group. Very often it's not. Very often it's a group of disparate people who hardly ever meet, except maybe for a function like a funeral. So we kind of go on the basis that all communities could do with being a bit more functional. And the Community Health Club is a platform to meet and discuss, which enables people to be more coordinated so that you get common unity. So community becomes common unity.
In a place like South Africa, TB is your number one killer. We're still having missed opportunities of vaccination. People with IT skills, doctors that have not just clinical background but want to have an impact on a bigger level, start looking at some of this data. If it's provided electronically, that would be great, but using the diversity and willing to work with the changes that are happening, I think it's wide open. If you're a pharmacist, but if you're a medical lab technician, we're starting in this age where we have big data. We really need to start looking at that data for trends, for disparities, for improving the quality. Whatever skill sets you have, I think it's wide open. But do you want to make a difference for that and not be just worried about my job security? We let some of the politicians and the administrations fix those things, but we have one of the largest TB burdens in the country that we really need to do something about.
Women are the architects of society, building bridges of success, empowering their families for a better quality of life. Hence, the role of women in healthcare is a very important one, whereby they educate their families on simple measures such as basic hand washing, safe water usage, and clean sanitation. The role of women is very strongly needed within healthcare.
When you talk about women, there's such a range, and I think the women that I really focus on are the poorest of the poor in the rural areas, and particularly in Africa. And you know, when we realize that 88% of the causes of the death of their children can be prevented by their own actions, by their own good hygiene, you really realize there's so much they can do for themselves without any inputs, without any medical attention. They can prevent diarrhea, they can prevent measles, malaria, bilharzia, skin diseases, worms, and all these things impact on the nutrition of a child and prevent it from being stunted. So therefore, we try to give women the ability to manage their own health by very simple hygiene practices that you and I would take for granted, but is not commonly known in the rural areas. Obviously, the higher class people in more sort of opulent living conditions have other challenges, you know, like how to control their diet, the use of drugs and alcohol, smoking. So public health is about trying to manage your own health, whether you're rich or poor.
If the youth are the future of our society, then there is no greater way to invest in the future than by investing in our youth. Here is a powerful message for the youth aspiring for a career in healthcare.
You just need to be sure if that is really what you want, because being a doctor, being a pharmacist, being a nurse, you are already a leader, because you are leading the general public. You are the one who's telling them how they should live their lives. And you need to understand that leadership is about service. So you need to know that if you cannot serve, then you cannot be a good health professional.
All work and no play makes Jack a dull boy. So we found out from the delegates if they were brave enough to surf Durban's waves. Let's find out.
Yeah, I'll take some in, but I don't know if I'll be surfing.
No.
Oh, I love the beaches, I really do. In fact, I was thinking about going down this afternoon.
No, I think our program here at the conference is a little bit too busy for that.
I'm not much of a surfer, but I will probably pop down to the beach and take a walk.
You are tuned into the Health Chronicle Spotlight. Follow us on our website www.healthchronicle.co.za or our social media sites, Twitter and Facebook. From Dock In, it's bye for now as I head out to Durban's beachfront.